Did you know that by the time you finish watching this video, around 20 seniors will have been diagnosed with dementia? That's one new diagnosis every 66 seconds. But here's the question that should really make you stop and think. What if the biggest reason isn't simply getting older? What if it's sitting inside your medicine cabinet right now? Most people believe the medications they take every day are completely safe because they were prescribed by a doctor or sold over the counter. But recent research is revealing some deeply concerning findings. Nearly every senior has at least one medication in their daily routine that may be affecting memory without them even realizing it. Some studies suggest certain drugs could reduce the size of critical memory centers in the brain by more than 28% in under a year. Take a moment to think about that. I know it sounds alarming. I'm Dr. Michael Kent, and throughout my years in practice, I've seen this happen far too often. People trust their medications without question. They naturally assume that if a doctor recommended it, it couldn't possibly be harming them. Yet for years, the pharmaceutical industry has been aware of concerns surrounding some of these medications, while billions of dollars continue to be made from drugs that may be contributing to cognitive decline in millions of older adults. A 2023 study published in Neurology and Aging Research found that one specific group of medications was linked to a 49% higher risk of dementia in seniors after just 2 years of regular use. That's not a minor increase. It's almost 1.5 times the normal risk. In today's video, I'm going to walk you through the 9 medications most strongly associated with rapid memory decline and dementia, starting with the ones people often overlook and ending with the one that may surprise you the most. And the medication ranked number 3 is prescribed to millions of seniors for something that seems completely harmless, yet it may shrink important memory centers in the brain while most people have no idea it's happening. Before we get started, I'd love to hear from you. Tell me in the comments which medications you take every day. Have you ever noticed brain fog, unusual forgetfulness, or memory problems after starting a new prescription? We read every comment and do our best to respond with information that relates to your situation. Don't keep your experience to yourself. Sharing it could help someone else protect their memory. Now let's begin with number 9. And don't underestimate it just because it's at the bottom of the list. This medication is found in medicine cabinets across the country and may be affecting your brain long before you notice any symptoms. Number 9 is diphenhydramine, better known as Benadryl. This familiar pink pill is trusted by millions to relieve allergies, help with sleep, or ease cold symptoms. It's inexpensive, easy to find at any pharmacy, and there's a good chance you already have a bottle at home. But while you think it's simply helping you sleep or controlling allergy symptoms, it may also be interfering with your hippocampus, the part of the brain responsible for creating and storing new memories. Benadryl belongs to a class of medications known as anticholinergics. These drugs block acetylcholine, an important brain chemical that plays a key role in memory formation and keeping your mind alert. As we age, the brain depends even more on the acetylcholine it can produce. When medications like Benadryl interrupt that process, the effects can become serious. According to a 2023 study published in the Journal of Geriatric Cognitive Health, seniors who regularly used anticholinergic medications had a 54% greater risk of developing dementia than those who avoided them. That's a significant increase for something many people consider nothing more than a simple sleep aid. So how can you reduce the risk? The first step is avoiding products that contain diphenhydramine, especially those labeled PM, nighttime, or allergy relief, since many of them contain the same ingredient under different brand names. If you use it for allergies, speak with your doctor about newer non-drowsy antihistamines, such as loratadine, commonly sold as Claritin. These medications do not cross into the brain the way Benadryl does and are considered much safer for long-term use in older adults. Never stop any medication without medical advice, but also remember that just because a medicine is sold over the counter doesn't automatically mean it's harmless for your brain. Next on the list is a medication many people believe is gentle on the stomach, yet it may slowly interfere with nutrients your brain depends on to stay healthy. Number 8 is proton pump inhibitors, including Prilosec and Nexium. These medications, often called PPIs, are commonly prescribed to treat acid reflux, GERD, and chronic heartburn by reducing stomach acid production. Many seniors remain on them for years because their symptoms quickly return when they stop. What often goes unmentioned is that long-term PPI use can reduce the body's ability to absorb vitamin B12, a nutrient that plays a vital role in protecting brain cells, supporting memory, maintaining focus, and helping regulate mood. A major 2016 study published in JAMA Neurology followed more than 73,000 adults aged 75 and older, and found that regular PPI users had a 44% higher risk of developing dementia compared with people who did not take these medications. By reducing stomach acid for extended periods, PPIs can also limit the absorption of magnesium and calcium, two minerals that help nerve cells communicate properly. Without enough of these nutrients, brain cells may not function as efficiently, leading to confusion, memory lapses, and symptoms that can resemble the early stages of Alzheimer's disease. Researchers have also found evidence suggesting PPIs may increase levels of amyloid beta proteins in the brain, which are closely linked with Alzheimer's disease. The good news is that safer options may be available. If you take a PPI every day, ask your doctor whether gradually switching to an H2 blocker, such as famotidine, sold as Pepcid, might be appropriate for you. While no medication is completely risk-free, H2 blockers are generally considered less likely to affect cognitive function. Some people also find relief through natural approaches such as deglycyrrhizinated licorice, which may help soothe the stomach lining without carrying the same concerns for brain health. Up next is a medication commonly prescribed for bladder control, but one that may also have a significant impact on both memory and emotional well-being. Number 7 is bladder control medication, specifically oxybutynin. Oxybutynin, sold under the brand name Ditropan, is frequently prescribed for overactive bladder and urinary incontinence. While it can be effective, it works by blocking acetylcholine, the same important brain chemical affected by Benadryl. Unlike some other medications in its class, oxybutynin crosses into the brain very easily, directly affecting the hippocampus and other memory-related areas. That makes it especially concerning for older adults who take it over long periods. A large 2019 study published in the British Medical Journal found that adults over 65 who use strong anticholinergic medications, such as oxybutynin, for more than a year had a 49% higher risk of developing dementia. Even more concerning, many patients are never warned about these possible cognitive effects. They're told the medication may help their bladder symptoms, but not that it could gradually affect their memory. As a result, brain fog, missed appointments, misplaced items, and trouble following conversations are often dismissed as normal aging instead of being linked to the medication. If you're taking oxybutynin and have noticed changes in your thinking or memory, talk with your doctor. Newer medications such as mirabegron, sold as Mirabetrek, work through a different pathway and generally have much less effect on memory because they don't block acetylcholine. For many older adults, they may be a safer option for long-term bladder control. Number 6 is statins. These are among the most commonly prescribed medications in the world, especially for adults over 60. Their purpose is to lower cholesterol and reduce the chances of heart attacks and strokes. Two of the most frequently prescribed are simvastatin, sold as Zocor, and atorvastatin, known as Lipitor. But there's another side to this story that many people never hear. Cholesterol isn't only important for your heart, it's also essential for your brain. Nearly 60% of the brain is made up of fat, and cholesterol plays a major role in maintaining the myelin sheath, the protective coating that allows nerve signals to travel efficiently. When cholesterol is reduced too aggressively, the brain may not get everything it needs to function at its best. A 2023 study published in Frontiers in Aging Neuroscience found that adults over 70 who had taken statins continuously for more than 3 years were 26% more likely to experience mild cognitive impairment. Those using higher doses appeared to have an even greater decline in memory and thinking skills. Some patients also reported sudden episodes of forgetfulness, including difficulty remembering familiar names, recent conversations, or even driving routes they had known for years. It's important to understand that not every statin affects the brain in the same way. Medications such as pravastatin and rosuvastatin cross into the brain much less readily and are generally believed to carry a lower risk of cognitive side effects. If you've been taking a statin for years and have noticed increasing brain fog, forgetfulness, or confusion, it's worth discussing with your doctor whether adjusting the dose or considering another treatment approach would be appropriate. Taking action early gives you a much better opportunity to protect your long-term cognitive health. Number 5 is benzodiazepines. This group includes medications such as lorazepam, sold as Ativan, diazepam, known as Valium, and alprazolam, commonly called Xanax. These drugs are widely prescribed for anxiety and sleep problems because they increase the activity of GABA, the brain's natural calming chemical. In the beginning, they often seem incredibly effective. They quiet anxious thoughts, reduce panic, and make falling asleep much easier. But over time, they can become difficult to stop and may create a very different set of problems. A 2022 study published in the British Medical Journal followed more than 8,000 seniors over 6 years and found that people who used benzodiazepines for longer than 3 months had a 51% higher risk of developing Alzheimer's disease. The risk appeared even greater with long-acting medications like diazepam, which remain in the body much longer and can accumulate in fatty tissues, including the brain. These medications gradually slow down brain activity, making it harder to learn new information, adapt to change, and maintain mental sharpness. Over time, many people begin experiencing confusion, memory lapses, slower thinking, and emotional numbness. Seniors often describe feeling like they're living in a constant mental haze, or simply not feeling like themselves anymore. One of the biggest challenges is that stopping these medications suddenly can trigger severe withdrawal symptoms, including intense anxiety, agitation, and insomnia, making people feel as though they can't live without them when the medication itself may be contributing to the problem. If you've been taking a benzodiazepine for more than a few weeks, never stop it abruptly. Doing so can be dangerous. Instead, work closely with your doctor to reduce the dose gradually over time. In many cases, alternatives such as buspirone or cognitive behavioral therapy for anxiety and insomnia can provide relief without the same long-term risks to memory and cognitive function. Number 4 is amitriptyline, sold under the brand name Elavil. Although it's an older antidepressant, it's still commonly prescribed for chronic pain, insomnia, and migraine prevention. At first glance, it seems like a medication that can solve several problems at once, but behind the scenes, it's one of the strongest anticholinergic drugs still in regular use. That means it significantly blocks acetylcholine, the brain chemical responsible for helping nerve cells communicate, create memories, and maintain clear thinking. Because of how powerfully it blocks this chemical, cognitive problems are not simply a possible side effect. They become much more likely with long-term use. A major 2015 study published in JAMA Internal Medicine followed more than 3,400 adults aged 65 and older and found that those with the highest long-term exposure to strong anticholinergic medications, such as amitriptyline, had a 54% greater chance of developing dementia over the following decade. That represents a substantial increase in risk. Unfortunately, many people prescribed amitriptyline for sleep or nerve pain are never informed that it may affect memory. Instead, they gradually begin noticing short-term forgetfulness, trouble finding words, difficulty concentrating, and persistent mental fog. Even low doses taken nightly for several years may slowly reduce cognitive function without obvious warning signs, making the decline appear to be nothing more than normal aging. If you or someone close to you is taking amitriptyline, speak with your healthcare provider about safer alternatives. For nerve pain, medications such as duloxetine or gabapentin may provide similar relief with less anticholinergic burden. For sleep, options like melatonin or very low-dose doxepin may be appropriate for some patients. And for depression, newer medications such as sertraline or citalopram are generally considered more suitable for long-term brain health. Number 3 is paroxetine, better known as Paxil. It's one of the most commonly prescribed SSRIs for depression and anxiety, and many people assume it's a modern antidepressant with a strong safety profile. However, there's one important difference that often isn't discussed. Paroxetine is the only SSRI with significant anticholinergic effects, meaning it also interferes with acetylcholine, the same brain chemical linked to memory formation. That makes it very different from other SSRIs, such as sertraline and escitalopram. A comprehensive review published in Frontiers in Psychiatry in 2021 compared the cognitive performance of older adults taking different SSRIs. Researchers found that seniors using paroxetine experience measurable declines in short-term memory, attention, and verbal recall within the first year of treatment. They were also about 30% more likely to show early signs of cognitive impairment than people taking other antidepressants. Ironically, a medication intended to improve mood and reduce anxiety may gradually reduce mental clarity over time. For older adults, many experts recommend avoiding paroxetine whenever possible. The American Geriatric Society includes it on the Beers criteria, a list of medications considered potentially inappropriate for many seniors because of safety concerns. If you're currently taking paroxetine, speak with your doctor about whether switching to another antidepressant, such as sertraline or escitalopram, may be a safer option. Supporting your overall health with adequate levels of vitamins like B12 and B6 may also help improve mood alongside other treatment strategies. Number 2 is antipsychotic medications. This one is especially concerning because many older adults don't even realize they've been prescribed one. Drugs such as quetiapine, sold as Seroquel, risperidone, known as Risperdal, and olanzapine, marketed as Zyprexa, were originally created to treat serious psychiatric illnesses like schizophrenia and bipolar disorder. Today, however, they're often prescribed off-label to seniors for sleep problems, agitation, or behavioral symptoms that can accompany dementia. In other words, medications designed for severe mental illness are now commonly used in hospitals and nursing homes for older adults who are confused, restless, or difficult to manage. The consequences can be significant. A large 2022 study published in The Lancet, Healthy Longevity, followed more than 25,000 older adults and found that seniors taking antipsychotic medications for behavioral symptoms were 71% more likely to experience worsening cognitive decline within just 1 year, even if they had shown no signs of dementia before starting treatment. These medications have also been linked to a greater risk of stroke, sudden cardiac death, heavy sedation, falls, emergency hospital admissions, and long-term placement in nursing facilities. The reason is that these drugs strongly suppress dopamine, a brain chemical that's essential not only for mood and motivation, but also for memory, decision-making, and higher-level thinking. As dopamine levels drop, the brain becomes slower and less responsive, which explains why many seniors taking these medications appear emotionally flat, mentally distant, or unusually withdrawn. Families often feel as though the personality of their loved one has slowly disappeared, even though they're still physically present. If you or someone you care about is currently taking one of these medications, it's important to have an open conversation with the prescribing doctor. Ask why the medication was started and whether it's truly necessary or simply being used because it makes caregiving easier. In many situations, behavioral symptoms can be managed through non-medication approaches, such as establishing consistent daily routines, reducing excess noise and stimulation, treating pain or physical discomfort, improving sleep habits, and creating a calmer environment. When medication is genuinely needed, using the lowest effective dose for the shortest possible time can help reduce the risks. Sadly, many families are never fully informed about how these drugs may affect the brain. They simply watch a loved one decline without realizing the medication itself may be playing a role. Number 1 isn't a single medication at all. It's something called anticholinergic polypharmacy, and it may be the biggest hidden contributor to medication-related cognitive decline in older adults. You might have expected one specific drug to top this list, but the greatest danger often comes from taking several medications with anticholinergic effects at the same time. Imagine someone taking diphenhydramine every night to sleep, oxybutynin for bladder control, and amitriptyline for chronic pain. Each medication on its own may cause only mild memory problems, but when they're combined, their effects build on one another, creating a much heavier anticholinergic burden on the brain. This isn't just a theory. A 2022 study published in Age and Aging tracked more than 280,000 older adults and found that those with the highest anticholinergic burden had a 120% greater risk of developing dementia within 10 years. That means their risk was more than double compared with people who had the lowest exposure. Perhaps the most troubling part is that many of these seniors had no idea they were taking multiple anticholinergic medications because no one had explained it to them. When acetylcholine is blocked from several different sources at once, the brain doesn't simply slow down for a while. Over time, nerve cells may become less active, important connections between brain cells can weaken, and cognitive performance may begin to resemble the changes seen in Alzheimer's disease. The good news is that addressing this problem usually doesn't require expensive treatments or miracle cures. It starts with a complete review of every medication you take, including prescriptions, over-the-counter products, and supplements. Ask your doctor or pharmacist to evaluate your overall anticholinergic burden. There are even professional tools that can calculate the score. Once high-risk medications have been identified, your healthcare provider may be able to gradually reduce unnecessary drugs, replace them with safer alternatives, and simplify your treatment plan whenever appropriate. This is one of the most encouraging parts of the entire discussion. In many cases, medication-related cognitive problems can improve when they're recognized early. As the overall medication burden is reduced, many seniors experience clearer thinking, better energy, and improved memory over the following weeks or months. The brain has an incredible ability to recover when it's given the opportunity. Anticholinergic polypharmacy is not only a serious concern, it's often preventable, which is why it deserves the #1 spot on this list.